The purpose of this video is to help you understand the process of facial reconstruction after the removal of skin cancer. In this video, we will cover general goals of reconstruction, possible options, and the recovery process. Before we begin, I want to address some very common feelings experienced by patients in your situation. Many people are coming to see a facial, plastic, and reconstructive surgeon after having a skin cancer removed. Most skin cancers are akin to icebergs. What you saw on the surface was only part of the cancer. What may have seemed like a little pimple on the skin ended up leaving a much bigger hole than anticipated. Many patients are uncomfortable voicing their concern about how this hole will alter their appearance. Remember, this is reconstructive surgery, performed to restore what was. If an important structure like your lip is missing, we need to restore that so you can eat and speak normally. Sometimes we need to do something to prevent loss of function that would occur if we let a wound heal on its own. This is common around the rim of the nose or the eyelid, where a wound left to heal on its own would distort the structure and cause either nasal collapse or draw your eyelid down. You will have a scar. There is no way around this. Anytime you have a cut on the skin, your body heals with a scarring process. The job of the plastic and reconstructive surgeon is to minimize the impact of those scars by placing them in strategic places. Many patients don't want to consider the option of doing nothing. However, in select cases, this will be not just the simplest, but the best option. Just because you are coming to see a reconstructive surgeon doesn't mean you need to have surgery. Our job is to pick the right reconstructive option for your particular wound. The concept of grafting dates back to the ancient Egyptians. Small pieces of skin or skin and cartilage can be taken from one part of your body and placed as a patch over a wound. Grafting is often the simplest reconstructive surgical option. Instead of waiting 6 to 8 weeks for your wound to heal on its own, the wound is covered immediately. Skin grafting isn't perfect in that the graft is hardly ever a perfect color match to the skin around the wound. Most people's nasal skin is redder than other areas on their body. The skin usually also differs in thickness as well as texture compared to the skin where it will be grafted. Skin grafts also don't live 100% of the time. Generally speaking, the bigger the graft, the higher the risk of failure. Living tissue requires blood supply in order to live. A tissue graft has been separated from its original donor site and must develop blood vessel connections at its new site. This doesn't always work. We will discuss all these things with you when considering your reconstructive options. Rearranging tissue around your wound is often the best option for many patients. The skin is the same color, texture, and thickness as the skin surrounding it. We will have to create incisions in the surrounding skin to allow us to move it into place, but those incisions generally heal as a fine white line. You will often hear us refer to this type of repair as a flap, as we will be lifting up a flap of skin to move into the wound. There are many types of flaps to use on the face. Which type of flap is best for you depends on many factors, including your skin type, your age, and the location of the wound. Occasionally, a hole is too big to be filled by using skin from immediately nearby, and too big to be filled by a graft. In this case, we have to borrow extra tissue from your forehead or your cheek. As I mentioned previously, tissue needs blood to survive. Therefore, this skin will be left attached to its donor site for a while as it grows into your wound. This will require a second-stage surgery to disconnect it. Occasionally, we are able to do this repair in the dermatologist's office. However, most often the surgery will require some specialized tools or would be too uncomfortable for you without anesthesia. If this is the case, we will perform your surgery in the operating room. Your role in taking care of your repair is very important. Your surgeon will give you detailed instructions regarding your specific repair. Remember, your reconstruction will begin with a surgery, but your body's healing process must play a role. Depending on the extent of reconstruction, it can take a week or more before people feel comfortable in public. And there will still be some swelling and redness that can take months to resolve. In summary, your surgeon will help you to choose which reconstructive route is best for you.